This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 12 in a 58-part video series of the entire book, and we recommend that you review the introduction video. If you have not seen that, you can check it in our channels. We're going to cover arginine. This is one of the most common amino acids produced naturally by the body when a person is healthy. Milk, dairy products, chicken, beef, pork, and seafood contain arginine. Oatmeal, peanuts, soybeans, buckwheat also have it. Normally, the human body requires hydrolysis of ATP to make arginine. ATP is the key energy source inside the cells of heart muscle tissue. Persons with heart failure need all the ATP they can get to increase their blood flow. Extra CoQ10 and carnitine are important for increased ATP in the cellular mitochondria. If you take arginine capsules or powder form, you do not require your body to rob your ATP energy from the heart to create arginine naturally. Therefore, taking arginine preserves that energy quantity that you need so much. Arginine is responsible for the creation of nitric oxide in the blood. This is known as a vasodilator. That means it opens up your blood vessels to increase blood flow, especially to the heart, for recovery and repair. Vasodilation also smooths out muscle cells inside blood vessels and larger veins and arteries. It reduces blood pressure, hypertension, naturally, and increases blood flow to all the organs, especially those that have been damaged by a reduction in flow. Clinical studies show a decrease of approximately 6.2 milligrams mercury of systolic blood pressure with supplementation. The distance walked test, that is a 6-minute walk test for one clinical study of heart failure patients, showed an increase of 8% of energy in just 6 weeks. These test subjects were given 2,800 milligrams of arginine twice daily. Another study conducted showed that subjects who received 3,000 milligrams 3 times a day were able to have a 41% improvement in their physical test. Also, the arginine consumption increased wound healing and other body tissues that were damaged. On and on, it shows that there are no problems with taking high doses of arginine, clear up to 30,000 milligrams per day. It is a natural amino acid used by the body, and the kidneys excrete any excess. Yet this book recommends starting off with 900 to 1,800 milligrams 3 times a day, and it is considered critical to heart failure recovery. We always recommend taking the minimum needed, but take enough. Do not scrimp on the amount you need, because its blood pressure lowering properties are quite important. In summary, arginine is a critical amino acid to reduce blood pressure, increase blood flow, increase heart muscle energy, to restore ejection fraction as much as possible. Athletes buy arginine in large bulk jars and just spoon it into their juice. This is the lowest cost form with no fillers, and you simply use a measuring teaspoon and check the quantity on the side of the label for what you need. I'm J. Randall Wilkerson. This is the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available at Amazon in print and Kindle edition, Apple iTunes in the iBooks format, and on eBay in the print edition. You can also order from the publisher Wilkerson & Hughes, P.O. Box 777, Altoona, Florida 32702. Thank you.